Welcome to the final phase of your long journey. This is the time where your skills and education are put to the test. This is the time where you develop the capabilities that will define your career. This is your best opportunity to learn from the best. And this is the best place to do it. The Hunter Holmes McGuire Veterans Administration Medical Center is a goldmine for residents who thirst for understanding of the widest variety of patient types, diseases, and injuries. This is also the place to help people who have been willing to give so much for our nation. Your residency is the last opportunity to learn medical treatment outside your chosen specialty. By now, you've heard that VCU has one of the most diverse patient populations of any medical center in the nation. Our diverse programs are equally diverse and extensive. But VCU's affiliation with the VA hospital has exponentially expanded the opportunities for residents.
The kind of training that they get is just exemplary. And if you would look at the board scores or whatever the certification exams are, they do very well. So that there's something behind that. There's a reason for that, and it's because they get great training as a resident during their stay at this program.
That's because this VA hospital is the second largest in the nation and offers one of the widest arrays of patient care of any hospital in the nation. This is one of the few VA hospitals that offer organ transplants. This VA is a primary Southeast referral site for tertiary care for soldiers returning from combat. This is one of 6 polytrauma centers devoted to treating amputees in the nation. The Richmond VA is one of the few VAs that specialize in geriatrics, women's health, and hospice care. Unlike many training hospitals, we've developed a hospitalist system that helps to more efficiently present patient cases to their doctors. And of course, with its association with VCU Medical Center, the McGuire VA is a top academic research facility.
They get to see a wide variety of patients. When we think of veterans, we typically think of our World War II and our Vietnam era veterans, but we actually have a large number of women veterans, a large number of younger veterans, both in the outpatient clinics and on the inpatient wards.
This VA in particular is one of the exceptional VAs in the country. We have a beautiful physical facility. We serve about 40,000 to 45,000 veterans. We get a huge spectrum of pathology that we deal daily. And then we have a unique medical record system that is very user-friendly. Finally, we have a faculty that is very accessible, and they consider teaching and training of young physicians sort of a privilege.
You can see almost twice the amount of bone increase as we do.
That love of teaching is a core value of both the VCU health system and the VA hospital. In fact, nearly 70% of all medical students rotate through a VA every year. This scenario is mutually beneficial. For VA hospitals, they have the extra help and fresh minds. Physicians and staffers are constantly reminding both students and themselves of the fundamentals of treating patients. For students and residents, there is no better teacher than learning in real time with some of the finest doctors in the region who are eager to teach.
We do have a pace that allows us to work enough, but at the same time to have time for teaching, discussion, and so on.
Interesting case.
It is not a high-intensity kind of work and allows consequently to have time for educational kind of activities.
Nationally, VA has been very supportive of medical education. That dates all the way back to the Second World War, when VA recognized to get high-quality physicians into the business of taking care of our veterans, the best route to do that was through affiliation with major medical schools, to the point where all new VA hospitals are always built in conjunction with an academic medical center.
VCU's affiliation with the VA goes deeper than the rewards of a thorough training experience. We consider it a great honor to tend to these men and women who made the choice to put themselves in harm's way for a nation that has given us so much opportunity.
The veterans really are an incredible patient population. They really are appreciative of the care that they're given here. And it's just a wonderful interaction that you have, a great place to really build your patient interaction skills.
Once you get to know some of these patients and hear the stories of their involvement with the service, whether it's World War II or Korean War, you can't help but be very, very buoyed by their devotion and the sacrifices they've made.
It really does instill a sense of, a sense of pride or a sense of wanting to give back to them what they have given to us.
With that honor comes great responsibility. So the VA has prided itself on offering extraordinary care for amputees and spinal cord injury patients.
There are some unique patient populations that we do deal with here that you're not actually seeing at other VAs across the country. In fact, we have a spinal cord injury unit, so oftentimes you'll get patient experiences with those patients, with that type of patient population. Also, we're one of, I believe, 4 or 5 polytrauma centers around the country. We have one of those units here, so you do have that opportunity to interact with that sort of patient population, which is really unique.
This mission also gives our physicians and staff the opportunity to do more in-depth studying of a patient's injuries and illnesses than some hospitals could afford to do.
We're very different from a for-profit hospital. We have the luxury of going the full course, and there's not that sort of pressure that perhaps they have in the private arena to get them out. So we clearly take care of them on the same level as the academic institution in terms of the quality of care, because we are providing the same care at VCU as well.
The Department of Medicine has about 250 protocols available for clinical research, and the residents have the opportunity either to associate themselves with a clinical investigator or with a basic science investigator and spend part of their time in the process of research.
This unparalleled research opportunity will enhance your capabilities to a high level when it's time to begin practicing medicine independently.
I'm a graduate of our program many years back, and I think one of my main criteria was being ready to practice in any environment. And I think VCU's program overall, with the VA component, provides education that prepares the residents to practice really anywhere.
I finished up Med-Peds, a combined internal medicine pediatric residency training program here at VCU, and I finished that up in 2001. And after I completed that, then I joined faculty and joined the staff here at the McGuire VA, part of the initial hospitalist service that we had started up in 2001, and I've been here ever since.
It's of little surprise then that so many doctors who perform their residency at the McGuire Veterans Administration Hospital stay on to pursue their passion, their craft, and their mission to be part of something larger than any of us. Welcome to the Hunter Holmes McGuire Veterans Administration Medical Center.